listening to The Doctor's Corner with Dr. Kline and Janelle Elgaway.
Good evening and welcome to the Doctor's Corner on Con Nation. I'm your host, Janelle Elgaway, and Dr. Kline. How are you, Dr. Kline? Oh. Dr. Kline, are you there?
Oops. I hit the cough button. Sorry about that.
That's okay. Hello. How are you doing this evening?
I'm doing fine, Janelle.
Good. Tonight, if you have questions for Dr. Kline about issues chronic pain patients may have with sex, depression, sleep, and many more, please call in at 415-915-2291. You can also chat live with our audience on our YouTube channel, Conspiracies Against Wellness live stream. So let's get into tonight. You and I were talking earlier about the different issues chronic pain patients deal with concerning with, sex, sleep, fatigue, depression, all that stuff. Why do chronic pain patients deal with so much problems that the people don't normally deal with?
Well, when anyone's in pain, it's a primal force that's telling your body you're in deep trouble. Because your body and your brain don't know what kind of trouble it is. All it knows is you're in serious trouble. And so the focus is entirely on the pain and the body's response to the pain, which in my consideration is inflammation. So you get a pain signal, and then your body goes into inflammatory mode and starts sending out all the soldiers to take care of the inflammation, and that becomes the sole focus. Mm-hmm. So it's very hard to focus on anything else. Eating, having a good time, raising your children, trying to work at your job, sex, affection, sitting on the porch and having a good time, holding hands. I mean, you can't, because your body is telling you that, hey, something is wrong and you're in trouble, and so focus on that. So it's a matter of your body protecting you, I think, more than anything else. So when difficulties arise, of course, taking care of the pain is the key thing. So
that's an interesting way to put it. We already have a call, if you don't mind.
Sure.
Caller from area code 215. What's your name?
It's Dr. Bill Mangino. Actually, I'm just listening.
Oh,
it's
okay.
the only way I can listen.
Okay.
But I'm enjoying it.
Good.
Your Dr. Kline is 100% on point. But I'm just going to listen. Thanks.
Okay.
Don't cut me off.
We won't. We'll just meet you. All right.
Thanks.
So, Dr. Kline, do females and males deal with the same amount of issues being chronic pain patients, and do females and males have the same amount of diseases and stuff like that from one another?
Yes, I think there's not much difference. I guess I should have said no. There's not much difference. I was talking to a male patient today, and he said, after having his medications replaced by his doctor, he was able to go to the soccer match with his kids. His sex life is terrible. He says, I'm just not interested, which is what I hear from women as well. And again, the pain has interrupted his business. He's an independent business person, and he was doing quite well until the doctors all decided that when he developed a herniated disc, that they really didn't bother to get an MRI to find out, nor did they do an exam. You can diagnose herniated discs in your back with a simple neurological exam that's taught to medical students. And then worse, they didn't bother to give him any pain. Oh, no, can't give you pain medicine. It's now against the rules at the great Duke University Medical Center.
It's against the rules.
It's against the rules for any doctor to prescribe opiates. The possessed pills, the demon pills. They all have to go to the Duke Pain Clinic, and currently there's a 4-month wait. So as far as I can see, this is just assassinating people.
Yeah.
I mean, what else can it be? I mean, what are these people doing? Oh, and the doctors, oh no, well, that's the rule. Yeah, well, we've had historical problems with doctors following the rules. We won't go into that, but there have been serious breaches in traditional ethics with doctors who don't stand up and say, no, I'm not going to do it, and if you want to fire me, fine, I'll go somewhere else.
Do you think it's because they're afraid, or is it because they're wanting to follow the CDC guidelines? What is it?
Well, picture these people sitting around a corner office with a big, beautiful table, and somebody's bringing them refreshments, and they're looking at their salaries. Used to be hospital administrators got about $200,000 a year. They're all getting $4 or $5 million a year now, along with all their cronies, the director of nursing, the CFO, the department heads that used to be in charge of teaching people about surgery and teaching people about medicine or dermatology. They're all just working for the corner office. So everybody becomes focused on how much money you can make, and one thing that might interfere with the money would be a visit from the DEA and getting into the newspaper. So to play it safe to ensure their incomes, never mind screwing all the patients, forget that. They just want to play it on the safe side. We're going to do what the CDC and the DEA tells us to do, then we won't get into trouble.
Right.
Of course, not treating people could get them into a lot of trouble if we could get some lawyers motivated, because that's negligent malpractice.
I was going to ask.
If you come to me and you have a serious bladder infection, and I say, well, you don't need antibiotics. What the heck? They just cause all these problems. I mean, you could go straight to your lawyer. Mm-hmm. And people can do the same thing when they're denied pain care. Any treatment that's denied a patient for no reason is negligent care. If the doctor says, oh, I have to take you off this medicine because you obviously have an allergic reaction to it, I can see the hives all over your body, different story. But that's not why people are being taken off. They're being taken off for corporate comfort zones.
So this has to be a really hard time for doctors, because they're kind of getting it from both ends. I mean, they're afraid about with all the stuff that's going on, but then they took an oath, to protect their patients and to care for their patients. So what do they do? I mean, how do they get around this?
Well, the doctors in Massachusetts, I don't know if we spoke about this last week, got together and retained lawyers to help them with the board of registration. Now, the medical boards can be as much problem as the DEA, actually sometimes worse. And so now they have lawyers, and they pay a small annual fee to have these lawyers on cell phones ready to go if they have to appear before board of registration in medicine. They could do the same thing. Doctors could get together, go to a law firm in their city, and say, look, how much would it take to retain you guys per person? And then they figure, well, let's see, we got 10,000 doctors, and what are we going to get? 5 DEA cases a year? So they work out a number. And then all the doctors have a lawyer ready to go on retainer. You just pick up the phone, call the number, and bingo, you've got somebody there. This protecting doctors against the DEA, I think, is important. You have to have specialized lawyers that deal with federal court cases, and but there's a lot of federal prosecutors out there who have practices, and so you go to criminal defense lawyers who are used to dealing with the DEA. And then when the DEA tries to run over some doctor, hey, wait a minute, you need to talk to my lawyer.
Why is there no unions or anything set up for doctors? I mean, hasn't anything like this come up in the past where you guys have been in this predicament, or no?
No, it has come up in the past, and there have been attempts to organize doctors into unions, but doctors are very conservative. Mm-hmm. And so just mentioning the word union makes them break out in a cold sweat. So then they tried associations like the American Medical Association, who's totally let us down. Where are they? They only represent 1 out of 8 doctors anyway. and they're receiving $75 million a year from the government in order to use their little billing codes, which ought to be free. And so, they're basically getting hush money. They're not going to say anything. The state medical societies, they're all afraid. Everybody is so afraid. I talked to one physician down in Mississippi Delta, and he said he was talking to all the docs down there, and they're all kind of country doctors, and they're used to doing their own thing. He said they were terrified, absolutely terrified that in one raid, they come in, show them up on TV, and, their practice is over, even if they're not convicted. Who wants to go to a doctor who's under federal investigation? So...
Oh, wow. I don't know if you heard anything about this or not, but I heard that the DEA go after knowingly doctors that have large amounts of money available there, and when they seize everything, they can take a certain amount of that money, regardless if they are wrong or not. Do you know anything about that more?
Yeah, actually, there's a couple agencies that have the right to do what's called civil forfeiture. Okay. And I give you an example. If you're caught at the lake fishing without a license, they can take your fishing rod and your car.
Really?
Yeah. So it's the same kind of thing. In other words, the DEA and other agencies, if you're under investigation, have the right to seize your assets. Now, this was originally put in there for drug cartel, drug lords, where they could take their ability to defend themselves away. But this is not an American way of dealing with equal protection under the law. No. This is awful. And it's time that Congress takes a look at the issue of civil forfeiture, not just the DEA, but everybody. And I don't know, I think people in this state, if you're caught hunting or something, they take your $1,500 rifle and they take your car. You got a nice pickup truck or something, they just take it, because you're illegally hunting. That's an odd kind of punishment. If somebody's illegally hunting, you arrest them or give them a warrant or something, have them appear in court, blah, blah, blah. You don't just take their truck away from them. That's
right.
awful.
Well, it starts kind of looking like, but, you would think that the punishment would be the same as, of what was wrong, not material things,
That's exactly right. It's an odd thing in this country, and it's gotten out of hand and needs to stop.
Right.
Because it's just not fair. This is not the way we do things in this country.
No, you're absolutely right. I wanted to talk a little bit about the North Carolina STOP Act law. It limits opioid prescriptions to 5 days for first-time patients with acute pain. What do you think about this?
The legislatures around the country declared emergency sessions after the CDC hysteria, the opiate hysteria, and called emergency sessions. Now, when you call an emergency session, guess what? You don't have to have public hearings.
Oh, really?
So they got one doctor in the North Carolina legislature, and so everybody turned to him, well, what should we do? And he just thought this was a great idea, that if you limit the number of pills, then you won't have all of these deaths and addictions.
Right.
This is based on opioid exposure.
Okay.
So, in other words, if I went down to Walmart and handed out bags of opioids, there would be a huge number addicted. One doctor, Gary Franklin, out in Washington State, was interviewed, and he said he thought between 20 and 30% of people who take pain medicines are dependent or addicted. Point being that if you are exposed to these opiates in medicine cabinets, too many in the emergency room, all the stories you read, this will increase the overdose deaths and the addictions. The problem is the legislature never asked me or anyone else, even though I wrote an editorial opposed to it in the News and Observer. Nobody asked me as a practicing physician or anyone else what they thought. So they think if you limit the pain medicine in the emergency room to 7 days, That means everybody gets 7 days. If I think somebody's really in a lot of pain, I might want to give them a month's worth. Oh, my God, you give somebody a month? They're just laying around, exposing people like they're radioactive. No, and next, we'll have these hordes of addicted people and everybody dying.
Are these? These are just created just for acute pain, though, right? Or are they really creating these laws to eventually stop all opioid prescriptions?
Well, it's opioid hysteria. You know, people are hysterical. Right now, the 7-day only applies to very first prescriptions in the emergency room. Now, if anybody took the time to discuss this issue with the addiction community, which supposedly the law is benefiting, less overdose deaths, they would find out that the people with addiction disease tell them it doesn't take a week to have your addiction triggered. Exactly. It gets triggered with 1 pill or 2 pills. That is the genetic addiction connection. I mean, nobody else could possibly pick this up that fast unless you've got something wrong with your brain and the way you're processing pain medicine. So the legislature didn't know what it was talking about because they didn't talk to any doctors. They didn't talk to any people with addiction disease. If you really want to stop addiction, you need to stop the opioids completely, not give a prescription for even 3 of them because 2 is enough to trigger the addiction. Right. So how common is this? My estimate is it's about 1 in 1,000 in the general population over age 20 who's never, ever been exposed to either alcohol or an opiate. That's how rare it is. So what we're doing is we are screwing 999 people out of 1,000 in order to try to prevent 1 case of addiction. Wow. Overdose deaths is not part of this. They claim that 7 days will prevent an overdose death. That's not true. If I had a prescription for 7 days, I could go home and take them all.
Right.
That would be enough. 7 days is enough. So now people have to go back to their doctors, because in 7 days they're still in pain. Then you got to rack up a doctor visit, right? Because the doctor should be reassessing you according to the opioid fanatics. So there you got to run up another bill, and so the insurance company, Medicare, got to pay for that. So basically, every single person that falls under this act is going to need to go to their doctor unnecessarily because they've just picked this arbitrary 7 days. It's another feel-good, take care of the legislator's comfort zone while putting people with pain disease in the emergency room in discomfort.
Mm-hmm. We have another call. Caller from area code 190. What's your name?
Hi, Janelle. This is Paula. Hello, Dr. Kline.
How are you?
I've had better days.
Oh, dear.
I've been on opioid painkillers for 20 years due to a work-related accident back in 1992. I have documentation from 3 different neurosurgeons that state that there's nothing that can be done for me. My doctor is now telling me that he cannot prescribe any opiates to me because he's supposedly under investigation. He stopped my medication cold turkey back on March the 28th and March the 21st. And I called the DEA, the CDC, the FDA, and the North Carolina Medical Board, and they all said that what he is doing is wrong, that he should be tapering me or treating me, one or the other.
That sounds correct. And, the CDC, remember, the CDC guideline, singular is the actual name of it, there is in the CDC guideline one time the word voluntary. These are voluntary guidelines. Plus, CDC has no business making any medical recommendations. That's up to the FDA. So anybody that says they're using the CDC is wrong. You got the correct response from people. They're saying the CDC is, not interfering with your doctor's practice. So basically, you got a doctor's refusing to treat you. And doctors who refuse to treat people, especially with those letters you have, need to be taken before the board. So you need to report him to the Board of Registration in Medicine in North Carolina for failing to treat you. And you can do it online, and they have a little button you press for complaints. You know, some doctors will retaliate. If they retaliate, you put in another complaint.
Okay.
The Board of Registration in Medicine will investigate every single complaint. They will contact the physician, and they may not do anything about it, but that's okay. That's their prerogative. But if they get enough people, they're going to say, hey, you know, we got a serious problem here. These doctors are refusing to provide medical care to people with painful disease. You can't do that. I mean, in my office, I could say, you have cancer? Too bad for you. You know, I can't treat that. I'm under investigation. You know, so I'm sorry, doctors need to have their feet held to the fire. This is an ancient profession, and over the past 2 years, they've tried to run it into the ground, and the doctors are falling for it. And I understand. I'm afraid to. Go ahead.
When I went to go to a pain management doctor in Chapel Hill, I was informed that I had tested positive for cannabinoids. And my doctor was the one that recommended that I try the CBD oil. And now I cannot find another doctor, and no lawyer wants to take on the case.
Yeah, lawyers are reticent. I think they kind of believe in the dogma, and I think they think doctors are doing the right thing to take care of this horrible opioid dope fiend, hysterical epidemic. I think that may be the reason, because you can certainly get damages from malpractice carriers for refusing to treat people or under-treating people. Okay. The clinic needs to be reported as well. They are claiming, and it's not illegal to have, trace amounts. And I don't think they can do anything about it. But, it doesn't hurt to put in complaints to the board. I mean, if they find that you're incorrect, they'll send you a letter. But, we need to make these things public through the Board of Registration in Medicine. I'm sorry, I cannot back up my colleagues. I think this is a horrible, horrible thing that's being done to people. And I tell the story
I appreciate your help.
Okay. I tell the story that the coal miners in West Virginia and Kentucky all had to go on strike in order to form a union back in the 1930s. And the threat there was real, because the owners hired people with deer rifles and shot and killed them. So, come on, doctors, let's get together and stop being bullied. So.
We have another question on YouTube Live from Jessica Adge. I'm sorry if I said that wrong. Why is it okay after 5 years of being with my doctor, 10 years with my CCP, my doctor put in my records that I'm opioid dependent?
Yeah, that's kind of tricky. The problem is opioid dependent is a word that's used properly, which means all people who take opiates become physically dependent. All they do. Probably just after a week or two, which means you'll have withdrawal symptoms if you stop. But that's the same thing is true for antidepressants and for sleep medicines and for tranquilizers and even for antipsychotic drugs. There's lots and lots of drugs that you get a biochemical linkage. Dependence is a terrible word. Biochemical linkage, so that when you stop, you will have symptoms. Now, a lot of people also use it to mean the same thing as addiction. So I would ask for clarification. You own the material in the records. The doctor owns the records themselves. It's sort of screwy. But you basically have a right to have your records corrected. And you just, say, what do you mean by dependent? And if you're claiming somebody's becoming addicted, you've got to put in there why. You can't just say somebody's addicted. You have to say why. I mean, I can't put in the medical record that I think this guy's got cancer and just not explain it.
Right.
So.
We have another question from Gemini from YouTube. Dr. Kline, does it put us into the U.S. into martial law if they claim emergency?
That's interesting.
Yeah.
Yeah, because, when all these states declared all these emergencies and the federal government wanted to declare all the emergencies, a lot of things happen. In the federal government, a lot of things happen. I don't know the details. But in the states, I do know that all of a sudden you don't have to have hearings, So you could just push through whatever agenda you feel like pushing through in the back rooms. I don't know where the legislators are getting their information. I do know that Andrew Kolodny from the PROP group, which is the Physicians for Reduction in Opioid Prescribing, has appeared in several states. It's documented. He writes them a letter and says he wants to be heard, and then he sends one of his lieutenants before the closed session of the legislature and gives them the anti-opiate line that if you don't control exposure to opiates, everybody's going to be dead and addicted within a short period of time. The legislators, they're have to listen to the doctor, right? And so then they have their emergency session and pass all these laws that are really not based on fact.
I'm just reading here on YouTube Live. They can't get their records of only treating PM doctor or DEA, who I know got my records. They can't get their treatments without the records. The DEA, when they raid a doctor's office, where do patients get their records at that point? What happens?
You get them from the DEA.
You do.
You write them a letter to their regional office and request your records, and they will provide you with a copy.
Okay. I wanted to go back when we were talking about the North Carolina STOP Act. All right, so Blue Cross Blue Shield has started electronically blocking scripts from being filled beyond the 5 to 7 days. Do you believe this is the correct way to deal with the problem of people becoming addicted or overdosed from opioid prescriptions written by doctors? And at what point is it? How do you write your prescriptions? What goes on with all this? Because there has to be a lot more that goes into this. Because once doctors and dentists are flagged in a database, and the DHHS doesn't have the authority to fine or otherwise discipline them, the News Observer from NC states that the law allows the agency only to notify practitioners and their various licensing boards about opioid prescriptions that look suspicious. To receive info from the Controlled Substance Reporting System to conduct investigations, the medical board has to go to adopt regulatory guidelines for the disclosure of confidential info, a process that needs to go through public hearings and to be approved by the NC Rules Review Commission. What do you think about all this?
Well, this is why I wrote the editorial. Once you pass these laws, guess what? They start to get worse and worse and worse. Yeah. And this is how police states get going. And we are very close to being under a police state. All of us medical providers, that includes dentists, veterinarians, they're going after veterinarians now, nurse practitioners, advanced nurse practitioners, physician assistants, physicians, everybody who can prescribe these medicines is now under a state police dragnet.
Wow.
Where they're looking at their computers. And in this country, you don't go around arresting people or taking legal action because they look suspicious. That's a very important constitutional protection we have. You do not get arrested for looking suspicious.
What is it anyway?
So suspicious would be 3 black guys in a neighborhood standing on the street corner, 3 Hispanics standing on a street corner with tattoos, or doctors who are prescribing in a way that's displeasing to the DEA and the CDC, which might be prescribing a lot of medicine for an individual. They have no business telling me I'm prescribing too much because my patient may need too much in their view. And then the next question is, well, state regulatory and law enforcement, what is too much? Well, their definition of too much is a doctor who's at the top of the list for prescribing. So you go in and take that doctor out, and guess what? The next person now becomes the top of the list. And then you take that person out, and they're still always at top of the list. You get down to the last doctor who's prescribing one prescription every 5 years, who's now at the top of the list. He prescribes the most in the state. And that's where it's going. No one has ever proved that doctors who prescribe a lot aren't doing so legitimately. You cannot take sanction against a doctor under suspicion that maybe too many prescriptions means the doctor is a crook and selling the pills out of his van. If that's the case, then law enforcement has to investigate that. They can't take screening information and do the same thing and say, well, you look kind of suspicious there, prescribing those extra medicines, and now you're prescribing benzodiazepines, and you're prescribing out of state, and all of those red flags, so therefore we're going to take action against you. Mm-hmm. That's not the way it works constitutionally. And it's the sorriest thing through all this is the worst crisis in American medical history, and it is an illegal crisis, and it is harming 5 to 6 million people every single day, and the lawyers are just doing nothing. You know, if you get a bad clam at a restaurant, no problem. They're down there in the courthouse filing lawsuits. So I don't know what the problem is with the lawyers. I really don't. So
we have a caller from area code 916. What's your name?
Pamela.
Hi, Pamela. How are you?
I'm good, and you?
Good, thank you. What's your question?
I just went through, I have a 28-year-old daughter, just turned in April. She was in a horrible car accident about 3.5 years ago, and she has been mostly bedbound. Unfortunately, fibromyalgia and symptoms of neuropathy have popped up. I myself am a 22-plus year RSD, CRPS, whatever they're calling it this week, sufferer, and has been on. I'm an opioid dependent, which opioid, that drives me crazy as a retired nurse. There is no such word. It's an opiate. Anyway, he came right out and told her in this last Thursday's appointment, and this is UC Davis, people. This is a teaching hospital. Told her he cannot ever order narcotics for nerve pain. That is now UC Davis's stance. When I asked him and challenged him about his information, some of which I've gotten from you, Dr. Kline, because I enjoy so much when you come on call, and please continue to come back. You edify us in ways that are truly making a difference out here in the real world. When I challenged him with some of your information, 10 million Americans function on opiates and narcotics and are not addicts, are not killing themselves, that the 1.5% that are dying are using these drugs either illegally or improperly. Although he went white and looked what he wanted to throw up in his boots, he continued to say, they, put quotation marks around they, will not allow me to prescribe any pain medication for your daughter. This is a 28-year-old young woman. No surgery is indicated as yet. She has private insurance. We've been waiting 6 months for an MRI. They know eventually there is nothing that can be done other than to control her pain with some form of pain management. And now it is their policy not to have pain management with narcotics. She's been on every non-narcotic known to man, and it does nothing. So when I asked him, what is the pharmaceutical middle ground? If UC Davis and these other hospitals are going to take this stance, and we already know what all the medications are out there that are non-narcotic, non-opiate, what is the middle ground? His face got red, and after a doctor of 18 years, he yelled at me and said, there is no effing middle ground.
Okay, time for some complaints. You need to file a complaint against this particular doctor and just give the whole scenario that you just gave us, and then you file a complaint with the California Department of Public Health that licenses the hospital. And you say it's become hospital policy that disallows my doctor from treating my daughter who has a bona fide painful disease that's been treated for X number of years, and now they're changing their mind. Just make it real simple. They're changing their mind. She was treated before. She had the proper indication. That's our word for reason. She had the proper indication for pain medicine. She's a palliative care patient, which means that she has no cure for her problems. And relieving the suffering would make a difference in her life. That's what palliative care is. And so you just send a little brief letter to the Board of Registration in Medicine and complain about this particular doctor and his conversation with you. And then you file another one with the state licensing board. Now, double check to be sure that the hospitals are licensed with the state health department, whatever it's called. You just got to Google that and find out. Or you can call the hospital. That'll shake them up. Call the administrator and say, who holds your license? Are you licensed in California? And if so, by whom? That'll get them going.
Have you ever heard of an entire institution taking that stance and having their doctor say that?
Oh, at Duke, I just mentioned a while ago, Duke Medical Center, the great Duke Medical Center here in Raleigh, just told all his doctors, don't prescribe any more opiates, send them all to the Duke Pain Clinic, where there's a 4-month wait. And according to our surveys, these pain clinics, 30% of them aren't prescribing opiates anyway. So they're not going to prescribe any. They're going to send you to a clinic where they're not going to prescribe any. This is assassination of patients, as far as I can see. Since a lot of people do go out and kill themselves, I would definitely sit down with my family if I was in a position of feeling like I'm not going to be able to get my pain relieved, and I'm laying there, can't sleep at night, can't function, takes me an hour to get out of bed in the morning, can't get to the bathroom, so I'm now incontinent. I would too. And so this is a serious thing. Yeah, and you can give them my list of suicides, which you can Google. Just Google medium, the word medium, suicides, and Kline, those 3 words, Kline, medium suicide Kline, and you'll get the current list that we have, which is going to be increased in the next couple weeks, and say this is the result, hospital board, of blanket policies coming off at the University of California, a state institution. And you know what? It would be good to visit your state representative, too. This is so egregious that a state-funded medical school-related hospital would have a policy like that. So
it's my alma mater. I was a nurse. It blew me away. I've never seen this. I've never, in my entire career, seen this. Never.
No, I haven't either. It's the worst crisis we've had. Yeah.
If you're allowing, as a doctor or a nurse, to allow your patient to be in pain, that is a form of torture. And in America, torture is illegal, is it not? If it is illegal in Abu Ghraib and in Gitmo, isn't it illegal in our own homes?
Yeah, and it's even worse than that because, letting a person's pain reemerge after being treated is particularly heinous.
Yeah.
The people in Gitmo are tortured for 2 or 3 hours, and then they go back to their room. People are being tortured by purposely, without consent, taking away their life-giving pain medicine is worse torture.
Agreed.
People need to be held accountable. You're welcome.
Absolutely. Thank you.
Yep. We have another call. Caller from area code 206. What's your name?
Hi, this is Mickey Nelson calling from Washington State.
Hi, Mickey. What's your question?
Hi. Well, I have a question about being able to clear your name if you have had something put in your medical records regarding misuse of opioids by a pain management doctor. Prior to seeing Dr. Tennant in California, I had been forced into pain management here in Washington State, and I had been prescribed Xanax by my family practice doctor, and the pain management doctor decided that he did not want me to take my low-dose Xanax along with the opioid that he was providing. And he actually required that I turn over the physical prescription pill bottle with the pills in the bottle in exchange for my prescription, which I thought was an odd behavior for a physician. So I called the Washington State Department of Licensing and asked if that was within the scope of any physician practice, and B, especially the CDC guidelines, because I asked him in particular if that was part of his practice. And the Washington State said they had never heard of any doctor in the state of Washington ever doing that. So they went and spoke to the senior doctor on staff, and that senior doctor came back, and his reply was, well, technically it's not illegal.
Yeah, well, you keep filing complaints.
Well, I left that practice, and when I asked for my records, and that's when I went down to see Dr. Tennant, and when I asked for my records, he had put in my records that I had demanded an increase in my opioid, which I certainly did not. All I asked for was my actual prescription.
Okay, there is a provision. Yeah, there is a provision in the HIPAA law, HIPAA. I always just spell it HIPPO. Anyway, there is a provision in there. If you just get on the Google, the world is yours, and you look up correcting errors in medical records, and that should get you to the federal privacy law, the HIPAA law. And there is a way to do it, and it's in there, and it's deep down inside, but there's a procedure that you can go through to get your record corrected, and I would definitely do it. Leaving stuff like that in on computers, I mean, now, 20 years from now, you've been in an emergency room, they go, aha, you were demanding opiates. You're not going to get anything here, young lady. So, you got to follow up on it. Also, I've told people before, a single phone call from a lawyer can get you a lot of help. In other words, the lawyer doesn't have to do anything. The lawyer just calls up and said, I understand there may be some errors in the medical record, and how do we go about, what's the procedure for fixing that? Doctors and hospitals, when they get calls from lawyers, start to sweat. So if you don't have a lawyer... Do you have a lawyer?
Okay. I do not have a lawyer.
Well, the way to get a lawyer is everybody should have a will. Everybody. I don't care if you're 20 years old. You should have a will. And so you find okay. So what you want to do is you want to go to the lawyer and pay him to do something like drafting a will or something, and then you have a relationship with the lawyer. You're his client or her client. And so then you can call upon them later and say, look, I'm having a problem with this. What can you advise?
Does it matter what type of lawyer?
No, it doesn't. All lawyers, the first thing you learn in law school is how to write a will. Mm-hmm. So everybody can do it, and that's their bread and butter. And this way you get a relationship with a lawyer. It's not a bad idea for everybody to have a family lawyer, to call upon if you get stuck or whatever, and lawyers kind of like that. They feel like you're part of the practice once they've written a will for you.
Okay.
Or financial planning, something like that. I don't know. You think of something that you need, and then you pay the lawyer, $300 or $400 or whatever to get your will written, but then you have a lawyer. See, and then you can get your lawyer, if they're willing, to call over there for $200 is usually what they charge for a phone call, and say, doctor, I got my client here, says that there's something in her medical record about her demanding opiates, and she states that, what can we do about this, doctor? Or call the hospital administrators. That'll make them sweat. These people are so afraid of lawsuits, they'll do anything to, they'll just, screw people in order to avoid lawsuits. This happened in North Carolina. There was a lawsuit about do not resuscitate. So all of a sudden, all the nursing homes just said, we're send them all to the hospital, and dishonoring all the NPR, all the do not resuscitate orders because of a lawsuit. It was about a lawsuit. So there aren't any. There's only 2 lawsuits suing doctors for not providing pain treatment. It's not enough. So they're afraid they don't want to be the first ones, and then all the other hospitals are going to be mad and won't invite them to those fancy cocktail parties in the lawn, with those white tents.
Mm-hmm. So, did you have any other questions?
Okay. Well, if I could just tag on one more question on the same subject, I did call the state back when I saw that comment in my chart note because it just appalled me that anyone would write anything like that in my record. And they said that you can request to have your records amended, but you can't force a doctor to change it. You can, if they don't change your record, what you can do is you can write essentially a paragraph and send it in to have it attached to your record, and then they're required by law to send that with a records request by whoever they send for your record.
Interesting.
But I didn't know that. Yeah. I can't force. How am I going to know if they actually do that? You see what I mean?
Well, that's why a lawyer would be very helpful. Yeah, because you don't have access to the computers and stuff. Yeah, I think it's serious enough to
take it away.
Yeah, no, it's serious enough that you need to have a lawyer help you out because that's going to be in your record. And if you go to an emergency room or you're post-operative, they're going to refuse to give you medicine.
Absolutely. Nikki, I might know somebody. When we get off here, I'll talk to you. Okay.
Okay. Thank you both. Appreciate it.
All right. You're welcome.
Thank you. We have another caller from area code 267. What's your name?
Yes.
Hi. What's your name?
My name's Rita.
Hi, Rita. What's your question?
Hi. I'm a big fan of your show. You're doing you just don't know the lives that you're changing with this show. I have a question for the doctor, specifically in the realm of pain management. I have 2 children. I had 3 children with sickle cell disease, and it has now become, as far as I can tell, a way to torture sickle cell patients with getting pain management involved. And often the pain management, they're not even doctors, they're nurse practitioners.
Yeah.
And I'm trying to make sense of it for myself, my children, as a parent, and other sickle cell patients, why this is now starting to occur.
Well, it's part of the opioid hysteria, and this is now a national issue, by the way, and maybe Janelle can put you in contact with some people. But this is a nationwide issue. It's not just you. This is happening to sickle cell families all across the country where the opioid fear has now infiltrated people with the horrors of painful crises that they have when they start to sickle. And it is one of the clear-cut reasons to give pain medicines. And anybody who doesn't want to give pain medicine to somebody in sickle cell crisis needs to be reported to the Board of Registration in Medicine. Just like I said before, this is no different than me saying to somebody, well, I'm sorry you have cancer, but I'm not going to treat you. I don't feel like it. The sickle cell is a big, big issue across the country. So don't feel that you're out there alone, because you aren't.
Oh, and unfortunately, I know I'm not out here alone. I wish I was out here alone, because it's the most horrific thing to live through, to see your child on a bed and doctors writing, saying that they're drug-seeking, they're narcotic-dependent, having my children escorted out of the hospital with security, saying that they're drug-dependent and narcotic-seeking. It's the worst thing.
Well, that's really awful. What I would suggest you do is contact your local TV station and tell them you've got an interesting story about yourself and your children and sickle cell anemia. And if you tell the story to a reporter, most TV stations, I think, would pick up on it.
Yeah.
And this is such an egregious horror that people need to know this. And I've been surprised that people call up TV stations as one person, and they'll come and tell their story. You know, so I would definitely get it out there. And you could contact your newspaper as well, because it is tied into the national sickle cell anemia crisis that's going on. And so this would be a good newsworthy story.
Did you have any other questions? Thank you, Rita, for calling in. Appreciate it.
Thank you.
So I wanted to ask a few things. You know, we are getting so many questions, and I apologize. I've been trying to look through here. Somebody was asking about New Jersey. In Medicaid, they were getting their prescriptions, opiate prescriptions, for 10 years, paid for and covered, and now they're not covering it. And I'm not sure if it's Medicaid won't cover it at all, or if they won't cover the prescription itself. But what do they do? Because there's a lot of people wondering what are they going to do, especially in 2019 when it comes that Medicare and Medicaid, you know, are going to make it harder for you to get prescriptions.
Well, you know, what did people do when and you were black and you went to a restaurant down south with your family for dinner, and they said, "Oh, you'll have to eat out back. You can come around to the kitchen." So what did people do? Right? They rose up and they started going on TV and they started holding signs and they created an embarrassing fuss. And then the restaurants, guess what they did? They started to serve folks who were traveling down the 301 down south because they couldn't stand the pressure. And what else did they do? They boycotted the restaurants. Okay, so there's things that people can do. It's nobody wants to do this, believe me. You know, during the civil rights movement, you remember the fire hose scenes? Those were all teenagers.
Wow.
And they were dressed in their Sunday school clothes. But that worked. And those kids took a hosing from you know, these animals. But it worked. And you know, when people saw this scene was given to be one of the reasons that Lyndon Johnson was able to get the 1964 Civil Rights pushed through. And we need another Civil Rights Act to protect people from the predation of these opioid fanatics who are claiming nobody should be on opiates because, according to the data from the CDC taken from the streets, from addiction communities, applies to the general population? No, it doesn't. It applies to the population on the streets. That's a rule in science. If you do a study on oak trees, you don't claim that it's going to work on a pine tree. That's basic science. The CDC made an enormous scientific error in trying to apply information from street addictions to the general population. So it's just like the Jim Crow laws. I mean, as far as I can see, this is like Jim Crow. They make up these rules they don't have the right to make up anyway. And look what's happening. Look what we're hearing tonight. So it's time for a massive retaliation, whatever people want to do. And, you know, it doesn't take many people carrying a sign to get on TV.
Right. Well, and, you know, the other thing is you have to remember a lot of chronic pain patients, too, are too sick to get out. I mean, we need our doctors, nurses, RNs, all of us coming together, family, friends, everybody. You know, it's so important that we get everybody involved. How do we get healthy people involved? That's what I want to know.
Well, you do what they did in the civil rights movement. You sit down and you say, look, this is an injustice. And you make your case. And if people start to realize that a person, and never talk about chronic pain, say, I have this disease. I have sickle cell anemia. My kids have sickle cell anemia. Whatever. I was post-operative. I went to the emergency room with a broken leg. And then you convince other people. And when you go out on the streets with signs, you bring other people along. You don't have to all be chronically ill. And some people will have a hard time doing this. And I know there's risks, for people who say, they have opiates in their house, and I understand that. But you don't, if you've got spokesmen out there, it only takes one or two people, maybe the chairman of a committee or something who represents the chronic pain patients that maybe isn't on opiates, could say, I used to have chronic pain, and I'm here to represent people because I know what it was like before I was able to get off them. So that takes the pressure away from getting your house raided. And you just have to be clever. During the civil rights movement, people sat around and they were clever. They figured out things to do. Boycotting buses for over a year in Birmingham, where everybody had to walk to work instead of taking a bus, worked. The bus company went broke. So being clever, but taking action, maybe start to boycott. I would love to see signs out in front of UC Davis.
Oh, yeah.
Here's a state institution, and you still have to go to your legislators, even though they say, I can't do anything about it, but they start to get notified that this is a problem.
Right.
And, pretty soon they say, well, gee whiz, we had 100 people in here with this problem. So you have to mobilize. You have to protest. It's gotten to the point where we have to do this. I'm not particularly a rabble-rouser, but the more I hear from people, the more I think individual action is just not going to work. Me sitting here on the radio, do you think they're going to change their minds, because I'm on the radio? Probably not. But we need to figure out ways to mobilize, and it doesn't take a lot of people. 4 or 5 people can get some of their friends, maybe get a doctor if you can find one, or get a nurse, that can wear a nurse's uniform, or a lab tech that wears a white, coat. Be clever. Try to think of people that can come and support you, and you'll get a news crew if you're down there in front of a hospital, even if it's only 5 or 6 people.
Oh yeah, and call ahead of time too, right?
Yeah, you call ahead. Very good point to the TV station. Say, look, a bunch of us are going to be out there in front of UC Davis. Call the police department. You have to get a permit, and they'll tell you where to stand and stuff. But that's a right that we all have, the right to assembly, and they'll walk you through it. Don't just go out there and do it. Get a permit from the police. They're usually pretty nice. And then you schedule it for a certain time. You let the news stations know you're going to be out there at 10 o'clock in the morning, and bingo, get the word out.
Yeah, that doesn't sound bad. I know there's been a lot of rallies and stuff like that, but everybody has hospitals in their local area,
Yeah.
Get people together, that would be kind of cool.
A sign that says refused pain treatment in the emergency room. Don't say opioids.
Yeah.
Pain medicine. Refused pain medicine in the emergency room. Refused pain medicine after my operation. And let me tell you, these hospital administrators looking at their big fat salaries do not want to get a phone call from the board of directors. Hey, George, what's going on out there?
Exactly. Well, we're going to take one more call here before we end, but caller from area code 862, what is your name?
Hi, it's Jessica. My name. I'm from New Jersey.
Hi, Jessica. What's your question?
Well, first I want to just say that I have a background in pharmaceutical regulatory affairs, and when I first started to see patients taken off their medications this way, cold turkey, and the things I saw online in support groups, I was encouraging people to voluntarily report it to FDA MedWatch, because I know that FDA looks for trends, and withdrawal symptoms are an adverse event. And I figured that would be a way to kind of bring some vision into that this is happening to people. So I wanted to just say that. But I also wanted to just ask a question about this article that I saw today about Walmart restricting the prescriptions for new acute patients to 7 days, and what are the legalities of that? Because I really don't feel like they should be able to pick and choose. And I keep thinking back to the early 90s when, the AIDS epidemic. Could you imagine, the the protest and the outrage at the discrimination if pharmacies decided, we're just not going to, fill AIDS patient prescriptions here. So I wanted to just find out, actually, if you guys know any of the legality around them, restricting these acute prescriptions.
Okay. Yeah, most pharmacy boards that license people like Walmart, get it? License. So you complain to the pharmacy board. Most all pharmacy boards require that if a pharmacist wants to question a prescription, they have to call the doctor. So if they're saying they're questioning the prescription and making it 7 days. Now, if the state has passed a 7-day limit, then they're probably using that as an excuse. But, here again, get some people out in front of Walmart. Get a permit, go out there in front of Walmart. Unfair to people with pain, but they may be doing it on the on the back of the state law, and I don't quite know how that works. But look up the state law and see if there's a 7-day. Now, here's an interesting thing: a state cannot overrule a federal law. In the Constitution, it's called the Supremacy Clause. The U.S. Constitution is supreme in the country, or else the states could just ignore everything. So by limiting the federal FDA and its regulations, which are the same as the law, the states are practicing nullification. Nullification is an attempt to nullify a federal law, and they do not have a leg to stand on. And nobody has brought that up. 2 comments, though. I was interested in your FDA MedWatch, is it called?
Uh-huh.
Can you just go online to this and start filing stuff?
Yes, you can. You can go to FDA has a MedWatch page that you can, as a patient, you can file for any adverse events that you have. And there's also a phone number which is easy. It's 1-800-FDA-1088.
Cool.
Great, thank you.
Yeah, that's something I didn't know. And also, the CDC guidelines call for, if there's going to be a reduction, which the CDC guidelines do not recommend, they're very clear that doctors and their patients need to work this out. There's a lot of mumbo-jumbo about tapering in there, but it's all kind of, if you want to try to taper, you have to get the patient's permission.
Yeah.
Before you do it.
I was just going to say, in the package insert in every narcotic, it talks about safe tapering. It's a safety issue, actually.
Okay.
So,
So there's a good way to hit this MedWatch is all these cases we're hearing of people just being jerked off their medicine, just bang, no medicine. Good Lord. What have we become? Is it that physicians in this country are having concept problems with pain? So anyway, this I like this MedWatch. So anything considered an adverse reaction. So that would be withdrawal symptoms that you don't need because you were forced off your medicine. Any kind of adverse reaction like that. Not being able to sleep because you're undertreated. Undertreatment is something that's worth reporting too. Since being undertreated, I cannot sleep anymore. I cannot get out of the bed. I cannot have sex. I cannot go down to my son's PTA meeting. You just put all that in there. That's an adverse effect. It's an adverse effect of getting less medicine than the FDA allows, and the FDA says you can have as much as you want as long as your doctor moves it up slowly and watches for side effects. So, great idea, MedWatch. The FDA.
Did you have any other questions or comments?
No, thank you very much. I'm glad I got the information, and hopefully people will use it.
Yeah, that's great.
Thanks for calling in.
You've been listening to The Doctor's Corner with Dr. Kline and Janelle Elgoway. Copyright 2018 by EXG LLC. All rights reserved.